Hello, I'm Elaine Berry. I'm here with Katie Melvin, where you just saw our latest addition to our mother-baby unit. Our special edition is our new mother goose that's just outside the windows of the mother-baby unit, and she is waiting for her babies to be born on her nest, and so when you come in to deliver, you may see her out in our courtyard on the maternity floor. And today we also have another special guest that is with us today. Katie Melvin is here. Hello. And she is one of our newest midwives. She is a Yale educated midwife that we are so excited to have because I've heard so many good things about you.
I'm excited to be here.
Yes, and you've done so much to help support our breastfeeding mothers too. So I wanted to just find out a little bit more about what you, how you got here, first of all, some of your education, and then how long you've been here and what you plan to do with while you're here, supporting our moms too.
Yeah, awesome. Well, like Elaine said, I just finished my midwifery training at Yale University in Connecticut, and I moved down here in October. I'm also a women's health nurse practitioner, and so I love supporting moms and babies in this very particular and very special time in their lives that is pregnancy, and I also help support women throughout their life with other GYN concerns that they might have. So I'm excited to be here in Owensboro, and I'm excited to be really helping with the breastfeeding initiative here at our hospital. One of the things that we're really trying to do is promote breastfeeding for our moms, so having higher numbers of breastfeeding moms here at Owensboro Health, and so I am all in for helping to support that goal.
Wonderful, wonderful. Yes, thank you. And I know that when you see a new patient, you have lots of information for them as they're deciding on how they're going to feed their babies. So.
Sure. Yeah, so I see a lot of our newly pregnant women in our office here at Owensboro Health, OBGYN, and one of the things we talk about at that first visit, even when a woman's very newly pregnant, is how does she want to feed her baby? And we talk about breastfeeding specifically. I go into the benefits of breastfeeding, so we talk about how breastfeeding moms give their babies a lot of immune fighting properties through the breast milk. Breastfed babies are less likely to develop chronic allergies or have food allergies, have chronic upper respiratory diseases, ear infections, because of those immune fighting properties they get through the breast milk. And then also we talk about how it actually lowers chronic disease. For babies that are breastfed, they're less likely to grow up to have high blood pressure and diabetes and be overweight. We talk about how there's some data to say breastfed babies are smarter even, and then we talk about the benefits to moms. So moms who breastfeed are more likely to have greater success with postpartum weight loss. There's also a reduced risk of high blood pressure and diabetes for moms who breastfeed, and it also lowers some of their female cancer risks. So we talk about all of those wonderful things that you guys get from breastfeeding. I also talk about the recommendation with breastfeeding. So the WHO, or the World Health Organization, recommends that moms exclusively breastfeed for the first 6 months of baby's life, and then from 6 months to a year, they recommend breastfeeding along with solid food. I tell moms that any amount of breast milk you can get in is wonderful because, not everybody can meet those recommendations or those goals, but any amount of breastfeeding is a wonderful amount of breastfeeding. There's nothing wrong with bottle milk, but you just don't find those extra benefits with breastfeeding that you do with bottle feeding. So we really try and emphasize that from a very early time in the pregnancy to get moms thinking about it. I also talk a lot about our resources here at the hospital. So we have a wonderful breastfeeding class that I encourage everybody to take while they're pregnant so they can get all their questions answered, learn more about what breastfeeding is and how beneficial it is for baby. And then I talk about other support systems we have here. So every day moms in the hospital after baby's born, lactation will come and see them in the hospital. So Elaine is one of these lovely women. And then we also have a support group that meets once a month. And then I also tell patients that if you're struggling at home and you really, baby's not latching well, you're struggling to get enough supply, you can always call lactation services and make an appointment to come in and just see them to talk about your very specific breastfeeding needs. So that's always an option too. So we do have a lot of resources here at Owensboro Health because we want women to be successful and we want them to be really well supported in their breastfeeding goals.
That's right, and that's one of the reasons we started these Facebook segments, is that we want the whole community to know that we are supporting moms and let them know that they can support moms in their decision to breastfeed too. We have our Breastfeeding Friends group that also meets every third Saturday of every month. That happens to be this Saturday. If anyone wants to come and join us, we have a scale there that moms can come and weigh their babies and talk to other moms that are breastfeeding and just have a good time with breastfeeding and find some new friends at that meeting also. If you want to come to any of the breastfeeding classes, you can just come. You can register online at our owensborohealth.org. It also has more information about breastfeeding and information about pumping and storing your milk. Is all online on our website also. So we would love to have you come and join us and come and be sure and see Katie when she's here too, and come and see her and find out more about breastfeeding and how you can be successful with breastfeeding. We're here to help you and support you in your decision, and hopefully the whole community will too, and even our Mother Goose will. And maybe when you come to see us, you may see her also.
She knew exactly the perfect spot to lay her eggs. She knew she'd be very well cared for here on our maternity floor.
Right. Thank you.